My name is Don Dubendorf, and I'm a member of the Lever Board, and I'm pleased to make this introduction this afternoon. It is uncommon for us to celebrate with words like agility, flexibility, adaptation, innovation when it comes to government function. We make jokes about it. I mean, during the Depression, the Roosevelt administration, the joke was, I'm here from the government and I'm here to help you. And that wasn't funny. Ronald Reagan ran an entire career saying government's the problem. And when we allow those characterizations and stereotypes to dominate, we miss the opportunity to celebrate the occasions when government is very special. And today, I couldn't be happier to introduce Carolyn Kirk as the Executive Director of the Mass Tech Collaborative. Mass Tech is an extraordinary arm of state government. It's quasi-public. It has an extraordinarily unique place in the economic affairs policy and implementation across the country. It's an exceptional organization, and as such is most effective when it's very, very well led. And today we get to celebrate a unique example of both the characteristic of the Mass Tech Collaborative and its current leader, Carolyn Kirk. Carolyn has deep roots in government, former mayor of the city of Gloucester, still a resident, even after she left the mayoral position. So that says something, right? Former deputy secretary in Housing and Economic Development. And I'd like for you all to welcome with me, Carolyn Kirk. Carolyn.
Appreciate that. Thank you. It is such a pleasure to be here today from Gloucester to Pittsfield. And thank you to the Lever team, Jeffrey and the entire team for having me here today. And I'm excited to share with you the story of an incredible story of innovation that unfolded during COVID. And it's the story of the MIRT, or miraculous MIRT, as Governor Baker once called it. So let me just start at the beginning. On March 10th, 2020, Governor Baker declared a state of emergency due to the public health emergency associated with the coronavirus, or COVID-19. And the governor established the command center, where teams were set up to handle the response across state government, from field hospitals to COVID testing to everything in between. And every day for months, if not a year, every day started with a check-in with the command center. And my organization was responsible for the team that led the manufacturing response across the state. And it was called the Manufacturing Emergency Response Team, or the MIRT for short. And our charge was to galvanize the Massachusetts manufacturing ecosystem and support our manufacturers in pivoting their operations to producing the needed materials that were in short supply to fight the pandemic. And there's a couple things I just want to get up right out front about the MIRT. About 60 volunteers came forward to support the effort and answered the call. And within 10 days of that state of emergency being declared, we had our first meeting over Zoom. Most of us had never met each other. And here you see the very humble MIRT headquarters. How many of us went from our lovely offices all of a sudden found ourselves having to operate from home. So one screen had an Excel spreadsheet, one screen had a Zoom call, another screen had a PowerPoint on it. And that became literally the headquarters for the MERT. And the second data point is over 550 manufacturing companies in Massachusetts came through the portal, which we had to set up to handle the incoming response because people wanted to help. And of those, just about 50 were able to pivot and scale quickly and put the products into the market that we needed to fight the pandemic. And they were supported by the MERT system. And the MERT system, comprised of those volunteers, provided assistance. So, for example, FDA regulations, overcoming supply chain issues, access to testing, packaging and labeling, and other matters that were unfamiliar to pivoting manufacturers. And then thirdly, these Massachusetts manufacturers, they produced and put into the market over 15 million pieces of PPE during 2020. It's a remarkable effort that took place. And not only just PPE, but other important materials that were needed. But in those PPE items were N95 respirators, surgical and medical masks, medical and isolation gowns, face coverings, hand sanitizers, face shields, other items like COVID-19 testing materials, swabs, viral transport medium, ventilators. And our program in Massachusetts was notable not only because of the volume of what was produced, but because of the variety. But did the story of MERT really begin on the day the governor started and declared the state of emergency on March 10th, 2020? Maybe our story started on April 10th, 1861. That was the date that the Massachusetts Institute of Technology was granted its charter by the Commonwealth of Massachusetts. That was 2 days before the start of the Civil War. And from its inception, the mission of MIT has been to educate students in science and technology and other areas of scholarship that will best serve the nation and the world. And the global prestige of the MIT brand attracted talent in the likes of Hayden Quinlan and Ben Linville Engler. And in the spirit of the Institute's mission of service to the nation, the university lent the expertise of both Ben and Hayden to the MERT effort on a full-time basis to help these manufacturers. Ben has deep experience with FDA regulations. And remember, these are pivoting manufacturers who had produced, athletic gear, for example, not exactly regulated. And now they are entering a highly regulated market and quickly navigating how to obtain an FDA emergency use authorization for a new product the company had never made before was crucial to the effort. Time was of the essence. We were getting phone calls about the shortage of these protective medical gowns in hospital settings and hearing of situations literally where staff, they were wearing rain ponchos to protect themselves as a last resort. And Ben worked day and night on behalf of the pivoting manufacturers to help them navigate the FDA landscape. Hayden lent his manufacturing expertise, and for example, labeling of materials. Any of you manufacturers, you know how important labeling is. And again, products going into medical settings, very important. We had a manufacturer who, we were talking about reusable medical gowns, and the standard label was good for 1,000 washes. And so that was the label that got put on the box. And so when pressed, we said, well, how many times did you wash the gown? 660. And we're like, okay, but you either have to wash it and test it and label it as 600 times, or go back and wash it and test it and label it 1,000. But you can't have it not be labeled properly. There was nothing that got through the MERT system that didn't meet our standard, because it was so important that the quality standards and the thresholds be met. So speaking of testing, maybe our story of innovation really started in 1897 when Lowell Textiles opened its doors. And Lowell Textile, with its rich history in chemistry and engineering, ultimately transformed into what we know now today as UMass Lowell. And when the call came to stand up a testing facility for the PPE that was being produced, UMass Lowell, under the leadership of Dr. Julie Chen, answered the call. And PPE is basically a textile product, so it was a natural fit. And within 60 days of the governor declaring the state of emergency, we had created a grant program to support the MERT, funded and stood up a testing lab, and began testing products for our pivoting manufacturers. The lab was a confidence lab as opposed to a certification lab, so that as the innovation was taking place with our manufacturers, they could bring the product into this confidence lab to get a sense of their design, go back and iterate. So then by the time they got to the certification lab, they had a very high likelihood of passing, because everybody in the world was trying to get PPE tested and out the door. And the wait times were months and months long, and the nearest testing lab was in New York City. So we iterated through these confidence lab cycles through UMass Lowell. And every day, we just watched the case counts go up, if you remember that first wave. So we all felt a sense of urgency. And so here we see Lieutenant Governor Polito and Governor Baker at the UMass Lowell testing lab, and it was for medical gowns, a variety of sorts, and N95 masks. So, but maybe our story really started in 1782, fully 240 years ago, with the establishment of the Harvard Medical School. The medical advisor to the MERT was Dr. Mark Zeidel, chairman, Department of Medicine, Harvard Medical School, where they have been expanding the boundaries of knowledge for centuries. And at first, we didn't even know that we needed each other. The Zoom invite for that first MERT call was passed around to anyone who was interested in the mission and thought they might be able to contribute. And Dr. Zeidel showed up, and we learned later, in his own words, he felt naked and alone in his search for PPE, because he was also a physician at Beth Israel Deaconess Medical Center. And meanwhile, back at the MERT, we were all struggling to understand this new language of respiratory virus, aerosolization, droplets, level of protection offered by various textiles like N95 masks, respirators, isolation gowns. It was just crazy. So after a few meetings where he really just observed who are all these strangers, I was able to kind of break the ice, and I peered through that Zoom screen, and I saw something that caught my eye in his office. And I got him talking, and he happily told me about the thing that was in his office. And from that day, have you had that happen to you on Zoom? Where how do I get to know this person on the other end of that Zoom call? And he became our de facto medical advisor. So I'm going to pause here and pick up our story of innovation in a moment. And I want to introduce you to a few members of the MERT team. So top row, we're going to go left to right. Farhad Vazigou, he is from Mass Tech, worked alongside with me day and night. Here I am beaming in from the MERT headquarters. There's Ben from MIT. Mike Tomasi, President and CEO of AccuRounds, is a manufacturer. We'll talk about him in a second. Dr. Julie Chen, Vice Chancellor of Research and Innovation at UMass Lowell. Second row, left to right, you see Dr. Zeidel in his bow tie. You can't really see it, but in the screen, he has a bicycle leaning against the wall. And that's what I saw. I was like, is that a bicycle? He was like, yeah, I bike to work every day. And I'm like, really? Tell me all about that. And he was so proud that he cycles to work every day. And that broke the ice. Todd Wolff, a colleague of his from Beth Israel Deaconess Medical Center. Christine Nolan from Mass Tech. Matthew Boyd, Western Mass. Roots, with his brother Stephen at the bottom of the third row. Faithful contributors to the MERT and creators and producers of Project Frontline. If you haven't seen that documentary yet, amazing. Masterfully has captured the Massachusetts COVID response, including the vaccine piece. And then last on the second row is Dr. Greg Rutledge from MIT Lincoln Labs. And they also set up a PPE testing facility specifically for the N95 masks that were coming in from China. You probably read about all this. And there were some questions about the quality of those masks that were coming in. And his team set up a testing lab for MEMA, or the Massachusetts Emergency Management Agency. And any product that didn't meet the N95 standard was pulled from the warehouse floor and not put in front of our healthcare workers. Third row to the right of Stephen Boyd, taking a sip of her drink there, is Liz Reynolds. She's now special assistant to the President of the United States for manufacturing and economic development. So, yep, she was on the MERT. Sasha from AFOA is there in the middle. We'll talk about him in a minute. Then we have Mark Smithers from Boston Engineering. And let me just say here, we had an entire team devoted to the ventilator problem. You remember, some of you may be having flashbacks, which, and I apologize for that. But we actually had to put Boston Engineering under contract because the ventilator problem was really complicated. And there were really 4 problems there. One was just manufacturing new tried and true ventilators that were trusted by the healthcare community to add to existing inventory. And our MERT grant program supported a Worcester company that manufactured 10,000 new ventilators in 2020 of a trusted brand. Number 2 ventilator problem was refurbishment plans for ventilators that were in hospitals that were just out of order. Number 3 was, ventilators have disposable parts. So as the parts needed to be replaced and they were in short supply, how do you get that supply chain reactivated? And 4, there were a lot of innovative designs coming forward for ventilators from the R&D centers, but those all needed to be evaluated and tested and accepted into the healthcare community, and some with mixed results. And last but not least, we have Jeffrey Thomas from Lever. You made the front screen. You know how Zoom works? There's a few more. So as I said earlier, we had over 500 companies that raised their hand and said, we want to help. Let me know if I'm going too long. We had over 500 companies that raised their hand and said, we want to help. And a lot of this was just out of sense of duty for their fellow citizens. And we said, we really want to help those companies too, because they can't realistically scale quickly and at the quantities that we need. And so this is an example of our methodology that we used. We used Mass MEP, which is the Manufacturing Extension Partnership, which is a nonprofit that supports the 7,000 manufacturers in Massachusetts. And they helped us vet these companies coming in. We sorted them into red, yellow, green. And we turned to Jeffrey and said, help us with the red and yellow companies. The green ones, we know that they can scale, and we push them out to the MERT experts. We got, depending upon the product, we got them in touch with what we call the product manager. We got them the resources they need on the manufacturing side, testing, the regulatory side, et cetera. So with Lever, we stood up 4 challenges, and we worked with these companies, and they went through Business Accelerator Program, 4 of them, and we gave out $150,000 in money to the companies that won the challenges. And so that was just a great, and so those were some of the most wonderful moments that we had in supporting these. And one of the winning companies is a company called Speakeasy, and they make these scarves. If you travel, they have secret pockets. You can put your passport in it. Well, their winning design was a face covering. It's got this, and it's got a little thing, and you pull it, and there's a secret pocket for a HEPA filter. So that was their design for a face covering, which was kind of cool. But I digress. Back to our main story of innovation. Not that that wasn't a main story of innovation, because that in itself was a big story of innovation. Oop. Oh, we're missing a slide. So our story could have started in 1861 with the founding of MIT, or in 1897 with the inception of the predecessor to UMass Lowell, or in 1782, fully 240 years ago, with the establishment of the Harvard Medical School. But it also had beginnings in 1838, when J. Makins Marrow founded the first knitting mill in America with his son, Joseph B. Marrow. Fast forward over 180 years, and here you see Joseph Marrow's great-nephew, Charlie Marrow, giving Governor Baker a tour of their cut and sew operation in Fall River, and they pivoted to make medical gowns. And the cut and sew operation, they activated within the first 2 months. And remember, they brought their workforce back, they implemented COVID safety protocols, and they were able to contribute. But the story also had beginnings with entrepreneurs like Brenna Nan Schneider, who started a company in Lawrence, and she started in 2013 with $7,000 in prize money from E4All Accelerator Program, 2 sewing machines, and an idea. And today, she has over 325 employees in Lawrence, Massachusetts. And just as an aside, the John Adams Innovation Institute, and Pat Larkin is here with us today. Pat, really good to see you, director of the John Adams Innovation Institute at Mass Tech Collaborative, has granted about $1.5 million to the E4All programs over the years. But you know what? And then there's Brenna. She, within 30 days of the Commonwealth having declared a state of emergency, both Marrow and 99 Degrees were under contract with the Commonwealth of Mass for 1 million medical gowns each. And with the support of MERT, both companies had pivoted, obtained raw materials, had product prototypes on their way to FDA emergency use authorizations, retrained their workforce, implemented the protocols, and committed to a delivery schedule. I mean, you just don't go under contract with the Commonwealth of Mass unless you can hit all of those requirements. So this was the governor announcing the award of those contracts during one of his daily press conferences with Brenna showing off her design. But speaking of raw materials, during this time, there was a worldwide scramble for N95 masks, medical gowns, and all the other PPE. Remember this, the pandemic started as a wave in Asia, and then it hit Europe, and then we watched it, like in Italy, remember that, for example, and then it crashed on our shores. And by this time, the entire world literally is in search of PPE. So how were we able to obtain the raw materials for our manufacturers? And again, the answer has its start prior to the declaration of the state of emergency. And the Manufacturing USA Institutes were established in 2014 by the Obama administration, and they were meant to just secure global leadership in advanced manufacturing. And one of the institutes is called AFOA, or the Advanced Functional Fabrics of America, and they're headquartered in Cambridge. And the Baker-Polito administration has put about $10 million into ensuring that the headquarters is here. And they're doing cutting-edge work in the textile industry. And Sasha is their executive director. And Sasha called everyone he knew in the world and got raw materials delivered to the factory in Lawrence for 99 degrees, for example, to make 1 million medical gowns for our people. So, isn't it amazing? This is like this is miraculous, like it makes me so proud. But there just might be one more date that marks the start of our story of innovation. And that's December 4th, 2019, when current Secretary of Housing and Economic Development, Mike Keneally, hosted the first meeting of what we call the Advanced Manufacturing Collaborative. And this is a group convened by the Secretary, co-chaired by Mike Tomasi, who you saw in the Zoom shot, the CEO of AccuRounds. And it includes about 25 members from industry, academia, and government, and it's organized by Mass Tech. And it's to this group that first call went out on the day that the state of emergency was declared. And that group convened just 4 months earlier. And because we were already organized as a manufacturing ecosystem, we were able to, and because we have this long history of innovation, miraculous was possible. And, I've only touched on a few of the volunteers and a handful of the many, many manufacturers who rose to the occasion. And in most cases, as I said before, they felt it was their duty to respond, and in such a time of dire need. And I know I carry with me the heartfelt thanks of Governor Baker, Lieutenant Governor Polito, Secretary Keneally, and they recognize and see the sacrifices that our manufacturers made and the volunteers made working day and night to make so much of this happen. And we're not going to know the names of the people who were impacted, but we know who they are. They're the healthcare workers that were buoyed in their work, that were protected because of the safe, reliable products that were put into their hands. They're the family members, the community members, the patients themselves that may have avoided tragedy otherwise without these needed materials, and they're you and me. So we may not be able to pinpoint the beginnings of innovation in Massachusetts, but surely it has no end. So. I'm happy to take any questions that folks might have, if there's time.
Hi, I'm Leanne Herman. I'm from Phillips Enterprises in Northampton, and we participated in the Lever Challenge.
Yep.
And our company typically makes custom display solutions, and during the pandemic, retail plummeted, and we found ourselves trying to come up with another plan. And through the Lever Challenge and the resources that you helped support, we were able to pivot and make plexiglass barriers for schools and businesses and fine-tune our business plans so we could keep our employees working during the pandemic. So thank you.
You're welcome. I remember the challenge well. I remember your presentation. It was, and I'm glad to see that you made a successful pivot.
I can ask a question. Yeah. Oh, excuse me. I'm Greg. I work for a local manufacturing company. We spoke a little while ago. Massachusetts was able to do this because it's a pretty wealthy state in a rather wealthy country. Did any of these products find their way to places outside of Mass or outside of the U.S. as a means to try to help perhaps less economically or financially buoyed countries or states or people?
Yeah, great question. So besides the contracts that the Commonwealth was able to secure with some of the manufacturers had to find their own markets and find their own customers. And so that the manufacturers were super aggressive in calling all across the country and finding customers, because this was for many of them, they made significant investment, and they were wanting to serve whoever they could. On the ventilator project, I had said there were a couple categories. There was one category of innovation on ventilator, and we were able to support a project where, in Pat Larkin's shop, the Innovation Institute supported this, where we were able to put ventilators as a kit, as a teachable workshop almost into sub-Saharan Africa through our partnership with WPI. And about how many ventilators went out? Like 125. So there was some opportunity, and we were mindful of not just doing this for ourselves, and the manufacturers certainly went out of their way to get customers wherever they could. Jeffrey.
I was really happy to live in Massachusetts during the pandemic, because we seem to lead in a lot of areas. Certainly, vaccinations being what people I think are most aware of. I was wondering, do you have any sense of how we did with PPE? How did Massachusetts, our response, compare to how other states did?
Yeah, it was heartbreaking. Other states were calling me, and FEMA called me. And it's the federal government. I was like, I'm running FEMA out of my house right now. Like, unless you're going to buy something from our manufacturers, I don't know how to help you. So the response was so, at that time, in the first 90 days, 120 days of the emergency, there came a time where we said, there's just no help coming. We're going to have to just do this ourselves. And you know, it was a heartbreaking moment. So we tried to help other states and say, well, do you have this and do you have that? Do you have these partnerships, and are there people you can call? And we tried to help our colleagues in other states. But if they didn't have the infrastructure and the relationships and that ability to galvanize quickly, you know, it was hard to watch.
Yeah, I think at that same time, if the news reports were true that states were bidding against each other to buy stuff from other manufacturers in other countries, I don't know if that was just a one-off, but the shot of you with the masks said made in Massachusetts. I seem to recall during one of the lever challenges some discussion about doing that affirmatively on many of the products because there was such a concern of quality of product coming from other countries and everything else, and that would be a selling point, that this was not necessarily made in the U.S., but particularly made in Massachusetts. Was that something that a lot of the manufacturers did as a way to promote their products and the quality, and, you know, not selling to the state, but selling
Right.
to other customers?
Yeah, you know, I think markets for these products is probably finding markets, having markets endure is was one of the biggest challenges during the time and continues to be one of the challenges. So two things there. That shot of the maiden that was Marrow, and they have a stitch that they have patented, and so there's that stitch that they used. But it wasn't so much that branding, it was all about price, because this is a commodity. And so there was no traction around that kind of brand. It was more getting the price point down to be able to compete. And the second thing, as the ones who decide they're going to stay in this marketplace, how are we going to compete? And that's the value of having Liz Reynolds, who's in the White House right now, who saw what these manufacturers are doing. We talked to her 2 weeks ago, and I said to her, where are our domestic policies on supporting these manufacturers? Because the next time this happens, then they all have to step up. They may not. And she is fully aware of the need for, and some, like Bay State Health has adopted an internal policy that says, we are going to set aside a certain amount of our budget, and we are only going to buy domestically or locally. And that's a corporate decision that they're going to make. Now, how can we have some policies that support but we have to support, they can't be on their own because the markets are too big and the product is just too voluminous at such a cheap price point in coming out of China, for example. So it's complicated, but we'll have help.
So one of the things I wanted to do, Carolyn, is to add another piece of history, and maybe it starts with the founding of the Mass Tech Collaborative. One of the pieces in the genes of your organization is the ability to create safe places for people with differing interests, but overlapping concerns and overlapping objectives. And as you create those safe spaces, some magical stuff happens, and that you create fertile ground for that to occur. And I think the MERT reinforces that reality. Lots of people came to a place that you convened and were prepared to share deeply about their troubles, what the challenges were, how we needed to collaborate, et cetera. And that's a unique attribute, I think, of what you and your team brought to the problem. And I don't think we should overlook that in your modesty, is what I'm trying to suggest.
Yeah. Well, I mean, that's public service at its best is that. We don't have a dog in the fight. We're advocating for the public good. We're not picking winners and losers. You know, we're collaboratively problem solving. I mean, that's really what in government, you know, the public trust of the people who were stewards, that really should I'd love for us to all have that sort of be our guiding light. And that's really, it did work. And we all felt that. We all felt that that was our mission. We woke up every single day. We're going to attack this problem today. And it went on and on and on. As you know, anybody who knows, who worked it in the front lines knows it just had no end till the vaccines came out. So, yeah.
So how long was it before the sort of PPE challenge, the PPE supply emergency had sort of, settled down? And how many of those companies are still producing any of that PPE, or have they just totally pivoted back to their other activities?
Yeah, so we also did, so a couple things there. One was we used MIT, so the manufacturers all just said, what is the future? What's the demand? What's the demand? So MIT Lincoln Labs also did a study for us, volunteered on projected demand for PPE. And in those early days, we all thought, okay, this is how it's going to be. It's going to be a big mountain. We're going to go up, and then we're going to come down. And the demand model was, this thing is coming in waves. This is how, and the waves are just going to keep coming until we get to herd immunity. And this is a guy who knows something about this, right? And so when you look at those demand, I know he's having PTSD right now. I know it. So you have these waves, and okay, well, the waves are going to just keep going until this pandemic is under control. And so that was what those demand models were showing. And so the manufacturers were like, all right, I'll make some business decisions about whether or not I'm going to stay in this business. So probably for the Massachusetts manufacturers, truly, is when the vaccines really rolled out in earnest, that's where the ones who are going to stay in are going to stay in. The ones, because the regulations that they got were emergency use authorizations, which are basically temporary. And to get the final regulatory approval from FDA on these products, that's a whole other round. And we couldn't support that. We could just get them to the point where they were good enough to get the emergency use authorization. And that's where they got to bring in their consultants and their lawyers and their product managers and now they got to set up a medical division of their manufacturing company. So only of the 50, only a handful have really doubled down and said, this is, the market's there, this is a business I want to be in. Yeah.
Wonderful presentation, thank you. Have you found time to document all of your learnings so we're more prepared for the next pandemic? Great question. So in the middle of all of this, we actually wrote a grant proposal to the National Science Foundation, and they funded it. And the purpose of the grant, so it's the whole MERT team, all the MIT guys and all the UMass Lowell folks and the WPI people and all the bunch of the manufacturers to document and capture and bottle what it is that we did. And the grant was for like $500,000 to be very precise. And then with the intention of replicating, because think about it, climate change, I don't know, we might have to like manufacture pipes someday, or I don't know, something, and how do you galvanize, because the Defense Production Act was never enacted for this. This is all voluntary on the part of the manufacturers. So how do you do this? So the answer is yes. But it doesn't get done for free. These people all need, MIT was only going to go so far in their service to the nation. So they have a grant to charge too. Anyway.
Thank you, Carolyn. Thank you so much. Just personally, I'm really, really grateful that you could come out here and be a part of this, and it's a trip involved, and you got a lot of other things on your plate, I know. So we're really grateful. Thank you.